You could say that the fluorescent guidance gives us a bit of superhero powers. We can see things that can't be seen by the eye alone, and we think that makes our operations both safer and more comprehensive.
Fluorescence-guided surgery is an enhancement of our traditional surgical techniques where we give a special dye that glows using our surgical cameras. And this is an FDA-approved drug that has been around since the 1950s and is extremely safe.
Here at Lurie Children's, we're really right at the front nationally and have figured out a number of new uses for the contrast dye. The hard part about surgery has always been telling the difference between what we need to cut out and what we need to leave behind, because on the insides, we're not labeled as we are in the anatomy books. The process of fluorescence-guided surgery is that we need the contrast dye, called ICG, and a special set of cameras, which can either be our minimally invasive or even our out in the open cameras to detect the glow. We give the contrast through a child's IV, and then if we watch right then, we immediately see it go everywhere that blood flow goes in the body.
This is a tool that we can use to enhance our surgical view for a number of different operations, both oncology operations and operations that we perform for a number of benign, routine conditions. From a cancer standpoint, this dye concentrates in certain types of tumor tissues so that the glow emanates just from the tumor tissue instead of from the normal surrounding tissue. So we can use that glow to help us identify and remove tumors, both in their primary location and also when they've metastasized or spread to other organs. We can use this dye and the fluorescent imaging in order to see any structure that has bile in it, including the gallbladder and the bile ducts. And so what this does is it enhances our view when we're performing gallbladder surgery. So removing the gallbladder or cholecystectomy is a very, very common operation. And one of the risks of that operation is that you might injure the main bile duct that drains the bile from the liver into the intestine. But with fluorescence imaging using indocyanine green, we can make that main bile duct light up so that we can visualize it and lower the risk of injury. Another use of indocyanine green is for looking at perfusion to different tissues. So when we administer this dye into the bloodstream, it rapidly perfuses through all of the tissue. And this is important because when we're doing surgery, we want to know if there's areas of tissue that don't have good blood perfusion. For instance, when we are removing a section of the intestine and putting the ends back together, but by using indocyanine green and looking with this fluorescent camera, we can very quickly and efficiently know that our connection will be at low risk for complications.
Using fluorescence with our standard safe operations makes things go better for both surgeon and patient and results in better outcomes, faster recovery. But, even more important than that is when we use fluorescence to take out more cancer than we would have otherwise found.